It was a Tuesday morning in February 2024 when hackers broke into Change Healthcare's network. Change Healthcare, the company that processes one out of every three patient prescriptions in America, the largest healthcare IT clearinghouse in the country, and part of United Health Group, a Fortune 5 company. The vulnerability? A Citrix portal with no multi-factor authentication. The attack? Credentials stolen from a previous breach. Someone had reused their password. Within hours, attackers deployed ransomware. Within days, prescription processing stopped nationwide. People are still digging out. Pharmacies couldn't fill prescriptions. Doctors couldn't verify insurance. The entire healthcare payment system ground to a halt. The ransom payment was $22 million in Bitcoin, but the total cost to United Healthcare was over $872 million. The number of Americans affected by this was 110 million, 1/3 of the entire country. And it started with just one reused password. Today, I'm going to tell you why your password habits are probably just as dangerous and exactly what to do about it. Here's what I need you to understand. You probably do this too. Most healthcare executives do. It's not laziness, it's cognitive load. Think about how many different logins you have. Epic or Cerner for your EMR, 3 different payer portals like United Healthcare, Aetna, or Blue Cross, maybe CAQH for credentialing, your benefit broker system, Zoom for telemedicine, your hospital's VPN, email, Slack, DocuSign, you get it. If you're a healthcare executive, you're juggling 47 different logins on average. 47. No human can remember 47 unique random passwords. So what do? We create systems. We use patterns like Health System 2024 ! Becomes Health System 2025 ! Next year. First name, last name becomes first name, last name 1, then first name, last name 2. You know we've done this. Epic password becomes Epic password ! Then maybe Epic 2024 ! We think we're being clever. We're following the rules. We're using capital letters, numbers, special characters. We change them when we're required and we get the email. But here's the problem. Hackers know these patterns too. They have databases of 15 billion compromised passwords from previous breaches. They feed these patterns to AI, which generates variations at 10,000 attempts per minute. The harder you try to remember your password, the more predictable it becomes. And healthcare workers are specifically targeted because patient data sells for $250 per record on the dark web. Credit card numbers, $5. Your important social security number, only $1. Medical records are worth 50 times more than financial data because they can't be changed. You can get a new credit card, you can't get a new medical history. Let's talk about what makes this even more dangerous in 2024. You're not just accessing EMRs anymore, you're using AI tools, ChatGPT for possibly clinical documentation, be careful, Claude for benefits analysis, Microsoft Copilot embedded in everything you touch now. Much of these tools has access to your data, your prompts, your uploads, your conversations. If you're a consultant like me, that's client work product, proprietary analyses, maybe strategic insights that come out of my brain. A compromised AI account isn't just email access. It's everything you've ever asked the AI, everything you've ever uploaded, potentially being exposed or used as training data for those systems. And the phishing attacks are perfect now. I can't tell the difference between a real Epic login page and a fake one, and neither can you. AI generates pixel-perfect copies with accurate context, sent at the right time of the day from what looks like a legitimate sender. Awareness training doesn't work anymore. That think before you click poster that's in the hospital break room, in my opinion, it's useless. The emails are perfect today. Now, password managers solve this by removing humans from the password creation process entirely. Instead of trying to remember 47 passwords, you remember only one, your master password. Everything else just gets stored in an encrypted vault. But here's the critical part. The password manager generates truly random passwords, not patterns, not words you can remember, but random strings like KJ8, $NQ, yada, yada, yada. No human pattern means no AI pattern recognition. No dictionary words means no brute force attacks. And no reuse means one compromised system doesn't cascade to others on the system. If Change Healthcare had used unique passwords for every system, that attack would have stopped at the very first door. One account compromise, not network access. Now, here's what you need to know before you go download a password manager. Check with your IT department first. Some health systems provide enterprise password managers, Keeper, 1Password, Teams, Bitwarden. If they give you one, then use theirs. Don't use a personal password manager for work credentials if they provided an enterprise solution. Some organizations have policies prohibiting personal password managers for work logins. This is less common today, but it exists and you need to ask first. Many organizations have no policy yet because password managers are still relatively new in healthcare IT. If they say we don't have a policy or yeah, that's fine, you're probably good to proceed. The question to ask is, do we have a recommended password manager? And if not, can I use a personal one for my work logins? If they say yes or have no policy, here are your options. There are no endorsements here, no affiliate links. I'm just going to walk you through what I actually do. I use Dashlane. I've been using it for years. I chose it because the interface is clean, the mobile app works flawlessly, and it has emergency access features. If something happens to me, my girlfriend can get into critical accounts after maybe a waiting period. Other solid choices are 1Password. That's what most tech companies use. It's great for Teams. It's got a browser extension that works everywhere. It's $36 a year, I think, for individuals, and there may be some enterprise options available too. Proton Pass from the people that make Proton Mail. They're in Sweden. Very privacy focused. It's open source, end-to-end encryption. It's good if you're already in the Proton ecosystem. I really like it. It's a free tier available too there, but it's $24 a year for premium, and I would highly recommend upgrading. Bitwarden is open source, which means security researchers can audit the code. It's only $10 a year for premium. It's the most affordable option, and you can actually self-host it if you want to in your own organization if you want full control. Honestly, I don't recommend that. All four have the features you need. AES 256 encryption, zero knowledge architecture. They can't see your passwords even if they wanted to. Mobile apps and browser extensions. Autofill for login forms. Be careful with that. Secure password sharing for things like shared vendor accounts. Audit logs if you need them for compliance. What matters most is that you use one, and any of these four is exponentially better than reusing your passwords. So here's the action plan. First, ask your IT department about password manager policy. Email them today. Do we have a recommended password manager? And if not, can I use a personal one for work logins? Second, if they approve or don't have a policy, choose one and set it up. This takes about 30 minutes to get it perfect. Third, migrate your 10 most critical logins. Start with your email. This is your password reset mechanism for everything else. Do your bank, your EMR, your EHR, your top 3 payer portals, any AI tools that you use for work. Fourth, generate new passwords for each of these, random, unique, 16 plus characters. The password manager will do this for you automatically. You'll know it's working when you try to remember your epic password in the future and you can't. That's the point. Random strings are unmemorable. That's what makes them secure. If you discover you've been reusing passwords, which is extremely likely, change them immediately. Start with email because that's how you'll reset everything else, like I mentioned. And if you think you clicked a suspicious link in the last 30 days, contact your IT team now, not tomorrow, but actually do that right now. That's it. That's the episode. Password managers, check with IT, set one up, migrate your critical logins. You can implement this today. I'm Dan McCoy. This is Rocket Tools. Thanks for watching.